I am Bethany DePaula, and I am the Residency Program Director for our University of Maryland PGY2 Psychiatric Pharmacy Residency. I've been Residency Director for about 15 years, 14 to 15 years. And I'm also a professor at the University of Maryland School of Pharmacy, which means that I'm involved with teaching. I have a collaborative practice with patients with psychiatric disorders and more specifically substance use disorders. We have a lot of patients with opioid use disorder. And so residents are going to be interacting with me through the residency program and also through rotation.
I chose the Psychiatric Pharmacy Residency program because of all the different experiences that they have to offer. With the program's curriculum, I have the opportunity to see a wide range of patient populations and disorders, from adolescent to geriatric to forensic, from acute inpatient care to long-term care, as well as outpatient care with your own prescriptive authority.
So our residency program really prepares you to either work as a psychiatric clinical pharmacist with a teaching component, so you might have students that rotate through and you serve as preceptors, or to potentially take on a position in academia and be in a clinical faculty position. The majority of our residents have gone on to those type of positions, but we have had residents that have had other opportunities. I've had a few residents that have moved on to work in the pharmaceutical industry. The director at the Maryland Psychiatric Research Center is actually one of our residents, so potentially to be more involved with research. So sort of the sky's the limit, but you can expect really strong training in clinical and academia.
The program is also affiliated with a world-renowned psychiatric research facility where you can get involved with any of the ongoing clinical trials that they're doing and publishable manuscripts.
We are ASHP accredited, and as such, we have a clinical component, a teaching component, and a research component, each of which are structured and will give you the opportunity to practice in various psychiatric pharmacy settings with preceptors who are pharmacists and are board certified in psychiatric pharmacy. You will have the opportunity to either complete a research project that is available through one of our state psychiatric hospitals, but you'll also be invited to go to the Maryland Psychiatric Research Center, which is an internationally known program for research with patients with schizophrenia, and potentially do a project there.
There are also tons of teaching opportunities within the School of Pharmacy and many opportunities to precept student pharmacists within your rotations. The preceptors are also amazing, knowledgeable, and passionate, and I truly feel like I'm learning from the best every single day.
We have opportunities in sister hospitals throughout the Baltimore metro area and outpatient settings, and so the residents really have an opportunity to make the residency what they want to a certain extent. We do a good job of training and including structure, but then helping you to sort of find yourself.
I believe the well-rounded curriculum and the supportive preceptors are preparing me to become an experienced clinician and teacher.